All right, welcome to the Modern Nurse Podcast. My name is Emily Knife. I am so stoked to be here with Ariane Williams, the kind nurse. And we are going to talk about several opportunities that patients, clients, and humans can absolutely dive into if they're looking at trying to check out alternative methods for their mental health and whole body wellness. So, welcome, Ariane. I'm so excited to have you here today.
Yeah, I'm excited to be here. Thank you for having me.
Yeah, of course. So let's just a little bit of backtrack here. So the kind nurse. So can you tell us a little bit, just a little bit about what you do as the kind nurse?
I do holistic health and wellness coaching. Um, and I help guide people with cannabis and psychedelics, using them mindfully, intentionally for a variety of different things. My main focus these days, because this is what people have seemed to be coming to me for, is medication tapering when it comes to antidepressant meds and like mental health support and stuff like that. And just people who are ready to explore other things outside of what they're typically prescribed. So that's what I do. I mean, that's not like I could go on and on and on, but that's like the gist of it. It's a very holistic approach with incorporating mindfulness, nutrition, lifestyle, and what I call like the foundations of health so that people can get into a state of feeling balanced and thriving and less dependent on other things.
Wow, that it sounds like the future of healthcare is here, and we're sitting right in front of it here with the kind nurse. So, thank you for sharing all of that wonderful information. So if I wanted to, let's just take people on a journey, what this might look like, because a lot of people are so familiar with our traditional approaches with medication, which is fine. We're both nurses, so we understand that medication is very useful in certain incidences, but it's also important to know the other side.
Yeah.
And so if I was looking to get off, maybe I'm on a couple antidepressants or one antidepressant and an anti-anxiety med. What would be the first step in this process of working with you?
So the first step is like having a very thorough assessment to check for appropriateness because I mean when someone decides that this is the path they want to take, we still have to make sure that it's appropriate and that people are well resourced when it comes to it because it's complex. So it's like really having a conversation of where you're at, what are your desires, what are you moving towards, what are some of the other things that you have tried, and like really what is your why? Like what do you want? And why are you wanting to stop what you're currently doing? Why is it not working for you? Because all of that is relevant, right? I mean, I work with people who are on meds who aren't wanting to come off. They're just looking for more stability or adjunct therapy. Like, so that's more of like an integrative cross like viewpoint of things as well. But it's really a personal decision and it's not appropriate for everybody. But I want to know, like, have you ever tried coming off in the past? What has that experience been like for you? Are you working with a physician? Because I am a registered nurse. I've been a registered nurse for 18 years, but I'm not a describer. So I'm not going to give a weaning or titration or tapering protocol for somebody, but I encourage people to talk to your physician, have them involved with it, and I can help the process be more easeful. And if their physicians are not on board and they want to take a more autonomous approach, then I can supply them with resources so that they can make the best choice for them. But I'm never going to tell somebody like, oh yeah, you should absolutely come off like and try to talk someone into it. Like I want to know where you're at so that I can meet you there. And if it's not the right time, then what are some other things that we can do to get you into a space that you're feeling good or that the time will come later? That's where it really starts. It's like an assessment, a thorough assessment, so that we can make sure that it is appropriate before moving forward with those.
Wow, wow. Already I feel so comfortable just even being in your presence if I wanted to move further with this, just because of the full depth of the assessment you just said is way beyond what we really kind of see in a traditional healthcare setting. I mean, you guys go full deep into understanding what that person's been through, what they've taken, what they've tried, what hasn't worked, what has worked, and That is so just so rich for that person that's coming to see you. So, all right. So after we do this wonderful assessment and you find that I'm probably not a good candidate, let's start with that. What does that look like from there?
Yeah, so if you're not a candidate to come off of your meds, right, then we start talking about things that can be used as an adjunct. I start educating around different herbs, whether it be, or vitamins, supplementation. We kind of talk a little bit about diet and movement. Are you even moving your body? How much sunshine are you getting? And things like that. All of that is relevant to our overall well-being. I talk to people about different cannabinoids that could possibly support them if, the issue is anxiety, but they're just not feeling like this is a good time, right? So there's other cannabinoids outside of THC that can be really helpful for that. Depending on the medication and depending on how many medications or whatever it is, we can even start talking about microdosing because microdosing can be appropriate with certain meds, but again, there has to be the assessment for it too. And I also talk to people about therapy. Like, are you in therapy? Is this something that you're open to exploring? What type of therapy are you doing? And if people are open to it and they don't have a physician or a therapist that they're working with, and I have a network of different therapists that I also work with that I can refer people to so that they can get supported. And then maybe after we do some of these other things, we can do a reevaluation and then we can move forward what it looks like to help you come down.
Wow, that's so great. I love that you just don't leave people hanging. Because we so much of the time see that in traditional healthcare, especially with mental health. A patient goes in and they get on some type of medication for their mental wellness and well-being. And then maybe they go back and it's not the right fit. And usually a provider doesn't really provide a lot of resources for that, or even opportunities. So it's wonderful that you allow that kind of a, like, not a stopping point, but just like a little bit of a halt to like see where that person meeting them, where they need to move from there. So that's wonderful. That's so amazing. Thank you for sharing that. And so on the other side of things, say I am approved, and we would be moving through, what would be the next part in this journey?
Yeah, so once we go through the initial assessment, if this is something that feels good for both parties involved, because I want someone to be a full body yes with working with me and for me to be a full body yes with working with them, right? So once we've done that, then we talk about the game plan, right? We have another call where we break down the supplements, the lifestyle. A lot of times people are using microdosing or low doses of psilocybin or mushrooms to help. I help them get resourced with that. I'm not necessarily a provider for that, but I can help you find safe resources. There's things all over the place that are available. And we talk about what it really looks like, because one of the things that I found is that using proper supplementation of the neurotransmitters is what is going to help decrease the withdrawal symptoms that people experience. Because that is something, like, so many people that I work with are like, I tried coming down before and I failed, like the withdrawals were so bad, or they came down and they like white knuckled through the withdrawals, they got to the other side of it, and then all of a sudden they had this rebound anxiety and depression. And a lot of times that's actually protracted antidepressant withdrawal symptom or syndrome, which is something that can happen days, weeks, even months after someone starts. And they're like, oh gosh, I failed. And like, what am I going to do now? I have to get back on the meds. So we really set up a customized game plan, right? We're going to start with some of these supplements, start easing down and tapering down in ways that feel good for the body. Because what I have also found is that oftentimes is that prescribers, and this is no fault of their own, are giving tapering schedules that are way too fast. So yes, your physician gives you a tapering schedule, but I'm also going to invite you to like listen to your body and check into what feels good for you. And if we need to elongate it a little bit, then we're going to do that, right? We're not going to rush this. There's no reason to rush. So that's, after the first few weeks of doing that, then we really start leaning into like some of the other things as well, like journaling, doing like mindfulness-based practices, movement, getting in community, getting creative, making sure that they're eating the right things so that it's being supplemented. And I don't want to like fire hose anybody in the beginning. So this is why it's like a step-by-step process and helping build safety in the beginning when we first start doing it to show like this can be a safe and easeful process. Like, let's get you feeling really good and safe. And then we'll start incorporating some of these other things along the way so that it's not so overwhelming of like, oh my gosh, I have to all this stuff I have to change like immediately. Like, no, you don't. You know, you can only eat an elephant one bite at a time, and we're just going to munch on this elephant as we go. It's okay, so that we can digest it, so this can be sustainable, not overwhelming. So much of it is building safety in the body, building safety with the emotions so that there's emotional resiliency that comes back on board and people can really have like transformational, sustainable change. And when I work with people, specifically with medication tapering, it can be anywhere from 3 to 4 to 5 months at a time because this is nothing that we need to rush into. A lot of people have been taking these meds for a very long time. So it just care, takes additional care to really make sure that people can be supported, feel really safe, and have the confidence to do this without it just being so overwhelming. So I hope that kind of gives a picture of what it looks like, but it is a very like mind, body, spirit way of working towards things.
Absolutely. Yeah, that information's great. And it really aligns with just in the world of sacred plant medicine in general. It's an alignment, it's an intention, and it's so important that our clients, our patients, just humans in general understand that it's you're working with the body, but you're also working with the medicine that's been given to us. And that's so powerful. So what have been some of your clients' experiences with these protocols that you've seen in reducing maybe their medication or even adding to their current protocols of medication? How has that been for you?
You know, honestly, I've been doing this work for 4 years and it is awe-inspiring like every time that I work with somebody because like one, a lot of the fear gets alleviated just purely from being witnessed, you know, and heard in their process and not being told that they're wrong or that they're not feeling what they're feeling, right? Because there's so much escapism or that's not the word I'm looking for. It's gaslighting. There's a lot of gaslighting that happens. So just being able to support them and is a big part of it because they feel seen and heard, which makes the process a lot easier. But it's fascinating how little people experience withdrawal with this. Like the withdrawals, if they're there, are minimum, you know, and I don't lead with microdosing because it's just it's a piece of the pie, right? But it's not going to do all the work. It is not the magic thing in there. It is something that can help a lot, but there are still these things that can happen. You know, if someone previously tried coming down and they'd been on their meds for like 15 years and they would experience extreme anxiety or a lot of irritation and they're picking fights with family members and they're just really dysregulated. And then we start incorporating some of these other things and the irritation may be like, oh, I felt irritated today, but I was aware of what was going on and I knew that and was able to communicate it, or I was able to stop and breathe, or I was able to stop and change my environment. And the irritation went away and it only lasted for a short period and then it was gone. Or the brain zaps, which so many people who have been on meds, including myself, like we know what the brain zaps are, right? They'll have brain zaps and then they'll take a supplement and then all of a sudden the brain zaps are gone, you know. So it's really beautiful that people are able to do this without, like I said, just feeling like shit. You know, they're not having the flu-like symptoms, they're not having the body aches, where before they were going into withdrawal like pretty quickly, like it's just so minimal, so they're able to continue to live their life and like feel good about what they're doing. And they have this increased presence and awareness around things that are going on. So they're able to identify some behaviors and some patterns, maybe some beliefs that were there that were actually perpetuating the issue. And they can start reframing themselves and they can start doing things differently, right? And that is like some of the coolest stuff that I've seen that I'm like, oh, like this isn't like I'm just being the witness and being the guide, right? But it's like the supplementation, the mushrooms, the plants that are really creating this, it's a co-creative relationship of like understanding the self deeper that they're able to connect to. And I get to be the Sherpa in that and the witness to it. So it's fun. It's fascinating.
That's so powerful. You know, it's there right now it's, you know, mushrooms are in the news with, you know, being more into the medical field, and we're going to put them in the sterile field, and we're going to put patients in the sterile field and try to give them mushrooms. And I just want to have your take on that and where you think, you know, because big farm's involved in this, right? So it's kind of it's like, are we really truly giving people the plant medicine, or are they just breaking it down too much, where it's not now a plant, really, it's kind of a chemical composition. Um, what are some of your thoughts on that?
You know, I think humans are going to human
Yeah.
and be the curiosity, right? And in order for it to be valid, we have to put it in a test tube and test it and do all of these things. So there is a sterility to it. A lot of the research that is has been conducted, like most of it, is with synthetic psilocybin or psilocin, or it is being extracted from something else that isn't even mushrooms. I think there was something that it was like some sort of mold that they were growing and then extracting the psilocin from that. Which is, I can't say like, is this not viable? Sure, I think it could be. But for me, I just prefer to work with the natural organics of things because for me, these plants and these mushrooms are benevolent and they have a deeper wisdom to them, um, that I think is really beautiful, which is why I always frame it like this is a co-creative process between you and the mushroom, right? Or the plant that we're working with. And it'll be your guide, but also you have to take the inspired action and be willing to listen and hear what it is that you need to shift and change along the way. So I think that we're gonna be humans, right?
Yeah.
But you cannot standardize nature. You cannot standardize healing for one person to another. And that's what I see in like the traditional Western med and in research is standardization for it to be valid. And you can't do that. Like we are nature. So
Yeah.
everything is curated it to us and our uniqueness. And whenever we have that and we're working with the organic forms of things or the nature-based things of it, like there's no standardization, which gives so much room for flow and adaptation versus it just being so rigid. So I have a lot of curiosity around it because the way that I work with people specifically with mushrooms is that it's not something that has to be done every day. It's something that's done a few days a week. And this is also not something that is a long-term treatment, right? This isn't a replacement. This is a path to your sovereignty, back to your empowerment, back to your choice and your autonomy within things. And it's not something that you necessarily have to do forever. You don't have to replace, you're not replacing something. You're using this as a tool to get you into a different space. And what I see is that people can do this and for extended periods of time, 4 or 5 months. I always tell people take a break because this is rewiring your brain. And if you don't stop it, how do you know what's being rewired? Which is completely against standard medicine, right? It's like, oh, we're going to get you started on this. You might have to be on it for the rest of your life, but it's fine. It's no big deal. But when we're working with these organic compounds in their natural state, like the invitation is take a break. Like, how do you know it's working if you don't take a break?
Yes. Yeah.
It's different. So, like I said, I believe in integrative things. I believe that there are different chemical compounds that are literally saving people's lives. I think there's a place for both. I just worry about just standardization and an exploitation of something that already works so beautifully on its own. And why can't we give space for that too? And just understand that nature is fluid and so are we.
Yes. Oh, it's so beautiful. Yeah, nature is fluid and so are we. Absolutely. Yeah, I mean, in everything in menstrual cycles and the moon. I mean, it's everywhere, but we're so disconnected from that. So I love that you also stated that this brings us back to ourselves, where so many people are disconnected, and I know, including myself, was disconnected for a while, and psilocybin came in right at a really great time for me. And I wouldn't be doing this podcast if I didn't use sacred plant medicine. It got me beyond my thoughts, my self-doubt, right? So what can it do for people kind of in the realm of wanting to maybe achieve certain things or not get rid of these mental blocks, but like you were saying, with the neuroplasticity of what it does to the mind, what are some things that you've seen from clients do that they were like, man, I would have not done this if I would have continued on that same path I was going down? Are there any potential like clients that stick out to you that really kind of come to mind of things that they've done after going through this journey with you?
Yeah, the first one that comes to mind is someone who like started their own business,
Yes. Yes.
something they had been thinking about and playing with, and then they started microdosing. And then all of a sudden it was like they felt so creative and they felt so clear and were able to execute things in a different way because the brain chatter or the negative self-talk had quieted down. And then their inner guide came online, that inner voice, that inner strength, and then they started executing things. And I actually went to like the grand opening of their shop when I was visiting. Yeah. And that was from the process of exploring an alternative, right? Because it encouraged this deeper like understanding of self and what they really wanted and this creativity, and it like lit this fire that they ended up starting their own business. I actually had that happen twice with people, is that they ended up on the other side. They're like, you know what? I don't know that I want to do this job the way I've been doing it. Like, I want to do something different. And then they did it. They felt inspired. And it's like all of these things just started falling in line because they were trusting the process and the path, and it just opened up for them. So that
Wow.
was, oh,
That
and
is,
another person, this one I think is really, really valid to share too. In the beginning of our process, and this was someone who was on meds but wasn't interested in coming off of meds, right? But they were grieving, like deep grief around estrangement with a family member. And I remember we were, having weekly check-ins, and in one of the calls, they were like, well, like, I'm not crying any less because unlike an antidepressant, this does not cause emotional dissociation. If anything, it helps you feel your emotions, not because it's increasing emotional sensitivity at these doses, but it increases the awareness around it. And she was like, well, I'm still crying, but at least I'm processing. And we worked together for 2 months. And at the end of the 2 months, like she had reconnected with the person that she was estranged with that she hadn't talked to in years. And they have like a beautiful relationship now. And like, because I still keep up with her and I talk to her occasionally, so it's like,
gives me chills. Wow. Dang. Makes me want to cry and it gives me chills at the same time just because that's so beautiful. And in 2 months, you know what I mean? And I'm thinking of just the times that, speaking with patients as a psych nurse for a while, patients get into grief and they can stay in that grief for a really long time and years and years and years and be on meds and meds and meds. And they're like, why isn't this working? And they don't know where to go. So where would be the best place to find the kind nurse so we can get these awesome services if we qualify for it?
so there's a couple of different things. I mean, I am on Instagram, so people could send me a direct message on Instagram. I have a website and I'm in the process of like redoing some of it, but it's just thekindnurse.com. There's information about med tapering on there right now, but I will be adding other information about just generalized microdosing on there, and different things like that. So yeah, that's where you can find me for the most part, as it is right now. I work also in contract work with Inthea Care. So, and Inthea Care's got a big following online, so people can schedule to talk to me through that as well. Where I do microdosing support for the company. But so there's a few different places to find me, but either direct message, go to my website, send me an email, Ariane, Ariane at thekindnurse.com. You can email me directly and I'll be happy to answer any questions.
Awesome, awesome. And Ariane's also speaking at Modern Nurse Fest. She's been on tour with us for a hot minute since October of 2024. And then she also spoke in Alaska. So please come out and see her at any of our Modern Nurse Fest. She's highly involved with us, and we are just so grateful that she graces us with her presence and her wisdom and knowledge. I mean, she really has has a knack for helping people through this beautiful work that she does. So thank you so much, Ariane and the Kind Nurse. Thank you so much for being on the Modern Nurse podcast. And we'll see you guys around. And again, reach out to her. If you guys, this is not just for you. This is like nurses, if you need this, reach out because this is an opportunity for you to switch it up. And she'll guide you along. So thank you, Ariane. Appreciate you. Take care. All right, let me stop this here.